Breast implant illness is a hot topic on social media. If you search it, you'll find testimonials of women holding implants that used to be in their bodies, talking about years of mysterious symptoms that didn't seem to be linked at all. But it's still not an official medical diagnosis. So what is it? We spoke to 3 local women who suffered for years without being believed by their doctors before finally having their implants removed. It was the early 2000s, and breast implants were quickly becoming one of the top cosmetic surgical procedures in the US.
Honestly, it sounds so
Olivia Thomas.
18 years old, I had no idea what I was doing. Honestly, I thought I was just gonna get big boobs and you're like, ooh, yay, life is great.
Anna Marie Frank.
I was having a lot of mental health problems at the time. And I thought, if I get breast implants, I'll be more attractive.
Jennifer Woodward.
My husband and I were newly married, and we had answered an ad to be a couple. To take pictures as couples. It was all on the up and up, but the first round of photography sessions, I remember the photographer saying, your body looks pretty good, but it would look better with breasts. And I was like, I know, I've thought that before myself.
Starting in 2006, breast augmentation became the #1 cosmetic surgery in the US, according to the American Society of Plastic Surgeons. It would stay on top until 2019. Hundreds of thousands of American women were getting the surgery every year. But for some, symptoms would start to appear months to years later. Symptoms that doctors couldn't explain.
First time was 6 months after I had it done. I started getting really weird, blurry vision. And then the puffiness started. I started getting crazy amounts of inflammation in my body. I'd go to my doctors and they'd tell me over and over and over, it's not your implants, you're fine.
For Jennifer, more than a decade later, symptoms started to pile up.
I had 4 children in 6 years and had thyroid issues, a diagnosis of Hashimoto's thyroiditis. My hair was falling out. I couldn't sleep. I was having panic attacks. I was struggling with anxiety for the first time. I don't really struggle with anxiety just normally. But along with that came some depression. I couldn't lose weight. I felt like I was puffy and kind of bloated all of the time.
Anna Marie says 8 to 10 years after she got implants, the pain set in.
Severe joint pain and discomfort. I could sit on the floor with my kids and go to stand up, and I felt like my legs could barely straighten.
All right, so raise your hand if you were ever made to feel crazy by your doctor because of the symptoms you were undergoing.
Absolutely.
Raise your hand if you had to research for yourself what was going on.
Oh yeah.
Raise your hand if you were told, what would your partner think if you got them out?
My doctors more offered me Prozac. They offered me the pill. They said, for your hormone symptoms, you might want to get on the pill. And this is multiple physicians. And for my sleep issues, you might want to take some Ambien, right? And for, your digestive issues, you might want to take some Prilosec.
Ranging from hardening of her breasts to heart palpitations, Olivia's symptoms went from bad to worse.
I was dying. I think if I wouldn't have gotten them out, I think that I wouldn't be here, honestly.
I do actually remember the first time a patient said this to me. I was in practice for about 4 years. So this is around 2018. And a patient came in and she said, Dr. Hirsch, my implants are giving me a rash. And I said, don't know what you mean by that, but I'm happy to take your implants out. 2 weeks after surgery, her rash was completely gone. She was really happy with how her breasts looked. And she said, I'm gonna put you onto my Facebook page. And the next clinic I came in, there were 2 or 3 more patients with similar symptoms.
As social media became more popular, women with similar stories started to connect, and their complaints were taken more seriously. In October 2021, the FDA approved new labeling to warn prospective patients that some women with implants were reporting symptoms ranging from fatigue, joint pain, anxiety, brain fog, autoimmune diseases, hair loss, depression, rash, headaches, to weight loss or gain. Now the implants bear a boxed warning, which is the FDA's highest safety-related warning. It's something that Dr. Elliot Hirsch, a reconstructive and cosmetic surgeon in Los Angeles, discusses with patients who want bigger breasts.
We certainly bring this up. We certainly say there are reports that include the warning. There are reports that women who have breast implants are experiencing these symptoms. This seems to be somewhat rare. We say less than 1% of patients are reporting this.
As for why some women experience these symptoms, the science isn't clear. But Dr. Hirsch is happy to see more studies being done to figure out why, and happy to see more doctors listening to their patients.
Every doctor told me that just to get them replaced because I would have little to no breast tissue. And then they would ask me, "Oh, what does your husband think?" And I was just like led to believe that I would be disformed if I got my breast implants out.
When patients take out their implants, I think the satisfaction rate of them removing their implants is actually pretty high.
Dr. Hirsch now sees more patients wanting implants removed than those who want them in. But even so, the cost can be prohibitive, between $10,000 and $15,000.
No insurance company is going to pay for you to get your breast implants removed when they are making you ill, which I find very frustrating because do we deny people with type 2 diabetes from their medications because of what they've chosen to put in their body and eat? Have we denied people that choose to smoke their whole life from lung cancer treatment? We don't. But yet women are demonized and said, well, you chose to get those breast implants. This is all in your head and you're to pay for that. That's wrong. That's really wrong.
But for Anna Marie, Olivia, and Jennifer, the physical toll was more costly. So they each chose Explant.
I actually blogged about it. So I have a picture of myself right before I went in for surgery. I wasn't on any medication yet. I was just doing my normal life. I have a picture of myself on medication after my surgery, and you can already see my face is so much clearer. My inflammation has gone down. Just immediately my body reacted to having that foreign substance out.
Each day I'm feeling better.
I'm so happy with my size B breasts.
Almost everybody says two things. They say, number one, my shoulders and neck feel better. And then number two is I feel like I can take a deep breath. A study was actually done last year of around 100 patients, and then followed them for 6 months and used standardized questionnaires to evaluate how they felt. And what they actually found was that there was a statistically significant improvement in symptoms, but what they also found was you couldn't predict what specific symptoms will improve.
Some doctors, like Dr. Hirsch, are willing to listen and happy to remove. Others won't even approve the surgery. And there are even a few plastic surgeons across the country who won't put implants in. They'll only take them out. What would you have told yourself if you could go back now?
I would ask myself, but will you be happy? But will you be content? I also remember telling my surgeon at 20 years old, before I had any children, I want to breastfeed my children. I'm going to have children. I'd like to breastfeed. Please make sure you don't cut my milk ducts. Well, what happened? I couldn't breastfeed my children. He cut my milk ducts. I felt the weight and responsibility and guilt of that for every single one of my 4 children.
Now, as a mom, Anna Marie thinks about what she'd say to her daughter.
I can't imagine her feeling the need to go to a surgeon to change the way she looks. She's, we're all beautiful how we are. And so, I just remember those moments and it was like, gosh, I feel sorry for my younger self that I didn't have the confidence.
Healing from scars on the outside and inside, and living a full life that has nothing to do with cup size.
I'm so grateful for these scars. They've helped me so much, but it's helped me.
Breast implant illness is not an official medical diagnosis. The Food and Drug Administration has also identified a possible link between breast implants and anaplastic large cell lymphoma, an uncommon cancer of the immune system. It's believed this may be related to textured implants, but the risk is still considered very low. For 17 News, I'm Maddie Jansen.